With us now is Senator Lisa Blunt Rochester, a Democrat from Delaware. Senator, nice to see you this morning. We just played some of the president's speech in nearby Pennsylvania. I want to play a little bit more about this message of apparent austerity he's sending to parents about how they may want to spend in the coming year. Listen.
You know, you can give up certain products. You can give up pencils. Because under the China policy, you know, every child can get 37 pencils. They only need one or two, you know. They don't need that many. But you always need steel. You don't need $37 for your daughter. 2 or 3 is nice, but you don't need $37.
So again, this was supposed to be about a speech about affordability. What do you think of that prescription to address issues surrounding affordability?
Well, I will start off by saying from the president who said he would bring down costs on day one, we are almost a full year in and people aren't seeing it or feeling it. And to make the reference that people don't have to buy a $27 or $37 for their child or multiple pencils, I think is really disconnected from the reality that many Americans are facing in this very present moment. You know, the reality is true that a lot of people are having to make very, very difficult decisions, but not just about the holidays, about their health care. And that's something that they shouldn't have to make a choice about, whether or not to pay for their health care or pay their rent. We've seen rent go up, we've seen energy prices go up, we've seen food go up, as you just showed. And so to even call it a hoax, to me, means that you are not really facing and understanding what people across this country are experiencing on a day-to-day basis.
Senator, you spoke about health care. Tomorrow there will be a vote in the Senate on the Democratic plan, which you are behind, to extend the Obamacare subsidies for 3 years. It's not expected to pass. So what happens then? When, frankly, it doesn't pass, what happens then?
Well, John, the reality is our Republican colleagues have an opportunity to do something here to make sure that it passes. Now, think back. We have been going for months encouraging our Republican colleagues to address this affordability issue that will really impact people's lives. We literally have an imminent problem with people's premiums about to spike. And so we need to take care of that immediate problem. And so what we as Democrats have put forward is a 3-year extension that acknowledges the present cliff, the crisis that we're in, but it also gives us room to really look at our healthcare system and make it better for the future. We acknowledge it is not perfect. It is not, you know, where we want it to be. But we do know that over the past 15 years, many families who had a member with a pre-existing condition is now able to get health care. Parents who had children who were in their early 20s can keep their kids on their health care plans. These are things that we want to keep, but we also know we have some opportunities here. So for us, the simplest path forward is to vote tomorrow to extend these tax credits and allow the American people to have some breathing room and allow us in Congress to have the opportunity. And I came to the House in 2016. I was elected running on health care. And I will tell you, since that time, I've seen my Republican colleagues try to replace and repeal and get rid of the Affordable Care Act, but without putting forward a real plan. We're putting forward something that can help people immediately.
Senator Cassidy and Crapo have a plan that they are putting on the floor tomorrow, which would basically fund some HSA accounts. They say it would give consumers the money directly rather than the insurance companies. What, if anything, is attractive about that to you?
No, I think Chairman Cassidy and I have already worked well together and have talked about different things that we can work on. But those are long term. What they're proposing is not going to help people at the end of this year, when they see, in the beginning of next year, when they see their premiums skyrocket. And so what we're proposing, again, is the simplest path forward. It gives us time to work on different ideas. And I was surprised that yesterday, I think maybe the 3rd or 4th plan came forward from my Republican colleagues. They need to pick a plan and they need to work with us, because we know that the American people are going to face this. And again, like I said, it's not just about dolls and pencils. This is about people's health care. And this is life and death for many people in this country. And it's farmers, it's small businesses, it's my constituents up and down the state of Delaware. So we need to take a step back, do the right thing tomorrow, and vote for this. It gives us the opportunity to do something on affordability for the American people.
Senator Lisa Blunt Rochester from Delaware, we appreciate your time this morning. Thank you.